Seizure disorders, presented by Grayson Rivers. What are seizure disorders? Seizure disorders are characterized by sudden, involuntary alterations in neurological functions caused by abnormal electrical discharges of neurons. The abnormality results in both changes in electrical activity in the brain and changes in behavior. Seizure disorders are prevalent in approximately 1.2% of the U.S. population. Of that 1.2%, 3 million are adults and 470,000 are children. Seizure disorders are the most common neurological condition in children. Epilepsy is the fourth most common neurological condition. There are 40 different seizure disorders. However, only 15 disorders are commonly diagnosed. Each disorder presents with specific symptom patterns, and they're categorized into 3 seizure types. Seizure disorders occur unprovoked with a neurological cause, such as asphyxia at birth, brain tumors, developmental brain abnormalities, or infections in the central nervous system. They can also occur unprovoked with no cause. This is referred to as idiopathic or cryptogenic epilepsy. 70% of children have these types of seizures. Seizure disorders can also occur provoked with a known cause, such as head trauma, sleep deprivation, a chemical imbalance, fever, or moderate to severe head injuries. Seizure symptoms include 2 types of presentations: motor symptoms and non-motor symptoms. Motor symptoms include clonic, which are rhythmic, jerking movements, atonic, weak or limp muscles, tonic, which are stiff muscles, myoclonic, which are muscle twitching, and epileptic spasms. Non-motor symptoms include behavior arrest, which means lack of movement, absence, which refers to staring spells, and atypical absence. This is staring blankly, blinking rapidly, and fluttering of the eyelids. Cognitive characteristics associated with seizure disorders include problems with thinking and memory, visual and verbal memory, deficits in working memory, planning, behavior inhibition, and difficulties with coordination. Academic characteristics include difficulty paying attention and concentration, trouble with task completion, and learning problems, specifically in math, spelling, reading, and reading comprehension. Social, emotional, and behavior functioning characteristics associated with seizure disorders include unstable mood, irritability, anxiety, visual hallucinations, and social isolation. Psychological disorders that are associated and comorbid include mood disorders, depression, sleep disorders, specific learning disorders, and autism spectrum disorder. So what can trigger a seizure? Seizure triggers include specific time of day or night, sleep deprivation, being too tired, not sleeping well, or not getting enough sleep, fevers, flashing bright lights or patterns, alcohol or drug use, stress, women's menstrual cycle, including hormone changes, low blood sugar, not eating well, specific foods, excess caffeine, so soda and coffee drinkers, and certain medications. So medications are important to watch for drug interactions. How do we differentiate seizure symptoms? There's 3 important things to remember. The onset of the seizure. This is where the seizure starts in the brain. The location often reflects the clinical expression. This can tell a lot about what may occur during a seizure, such as other conditions or symptoms. The individual's level of awareness during a seizure. Is the individual aware? Do they have sort of an idea what's going on, or are they unconscious? This is also important for their safety. And last, movements during a seizure. This helps distinguish between motor and non-motor symptoms. This is especially helpful for narrowing down the type of seizures. Focal onset seizures have two types, onset aware and onset impaired awareness. The individual is awake and aware, or the individual is confused and awareness is infected. Frequently, these types of seizures are preceded by an aura, or a warning. This is a strange feeling or fear, nausea, and odor, or an unusual taste. These types of seizures have motor symptoms that include tonic, clonic, atonic, and myoclonic. They also have what's called automatisms, which is rubbing of hands, lip smacking, chewing, and mumbling. These are just repeated automatic movements. Non-motor symptoms include behavior arrest and changes in sensation, emotions, or cognition. Generalized onset seizures are sudden, without aura, and generally involve a loss of consciousness. Motor symptoms include tonic, clonic, atonic, and myoclonic, and also epileptic spasms. Non-motor symptoms include absence and atypical absence. Unknown onset seizures include motor symptoms of tonic-clonic and non-motor symptoms of behavior arrest. This image represents the phases of a tonic-clonic seizure. If we look at Homer right here, he has an aura phase. I'm not sure if y'all can read the words underneath the pictures, so I'll read them to you. Underneath the aura phase, it says lightheadedness, dizziness, confusion, and hallucination. Then he moves to the tonic phase. He has skeletal muscles teasing up, jerky movements, and unusually lost consciousness. Then the clonic phase. Convulsions, violently shaking, uncontrollable twitching, and sometimes his breathing stops. And then after the clonic phase, he has post-ictal sleep. When he wakes up, he's confused, he has some amnesia, and he's nauseous when he's waking up. So, just preparing for review, what kind of seizure do you think this is? Oh yeah, I forgot that y'all can't respond, sorry. Well, since he had an aura phase, we automatically know that it's a type of focal onset seizure. And then if you go to the tonic phase, he lost some type of consciousness. That means he wasn't totally aware of what was going on. So, I don't actually have the answer to this, but if I had to use my best educated guess based on all of the information presented, I would say that this is a focal onset impaired awareness seizure. So now let's switch gears and talk about some seizure disorders. Epilepsy is recurrent, unprovoked seizures occurring greater than 24 hours apart. 10 to 20% of individuals have mixed seizures. In order to get a diagnosis of epilepsy, an individual must have 2 recurrent unprovoked seizures or 1 recurrent unprovoked seizure with a likelihood of more. The seizures must not be caused by a known or reversible medical condition. Neonatal seizures are tonic seizures in preterm infants. They are rare in full-term infants. 15 to 40% of infants with neonatal seizures die. 35% receive an intellectual disability diagnosis and/or cerebral palsy. These seizures are often misdiagnosed, given infants' typical motor behavior. Febrile seizures are tonic-clonic seizures in children, ages 3 months to 6 years, during the presence of high fever. Febrile seizures often remit after 6 years. These type of seizures occur in 2 to 5% of all children. Psychogenic seizures are formerly known as pseudoseizures, and they're also referred to as non-epileptic seizures. These are caused by subconscious thoughts, emotions, or stress. These seizures are non-epileptic, but they are psychological. They do not have any abnormal brain activity or electrical activity, but these seizures can be a result of a psychological disorder. And then we have refractory seizures. These are uncontrolled seizures. Sometimes these type of seizures can be a result of incorrect diagnosis, thus incorrect treatment, triggers or lifestyle factors, or an individual can be properly diagnosed but may not respond to medical treatment. We've talked about focal impaired awareness, epilepsy, febrile seizures, neonatal seizures, psychogenic seizures, and refractory seizures. But we've actually already talked about focal to bilateral tonic-clonic seizures, tonic seizures, clonic seizures, tonic-clonic seizures, microclonic seizures, atonic seizures, absence seizures, and atypical absence seizures. Together, all of these seizures represent the 15 commonly diagnosed seizures. Seizure disorders are diagnosed by a medical doctor, but it's also important to remember how to differentiate between the symptoms, because this information is really important to relate to a healthcare professional, especially since seizures rarely happen in or at the doctor's office. So remember, the onset of a seizure, the individual's level of awareness during a seizure, and movements during a seizure. Doctors often look at a family history, detailed medical history. They use blood tests, EEGs, and they do brain imaging. They use CTs and MRIs. This image represents an EEG on an individual who's having a seizure. So if you look at the right brain, you can see normal brain activity, but if you look in the left brain and the part that's highlighted red, you can see the abnormal electrical activity. What are treatments for seizure disorders? The most preferred treatment option is anti-seizure medication to control the seizures. This is because these type of medications avoid drug interactions and result in fewer physical and cognitive side effects. There's also surgery. In this, the type of surgeries performed remove and clip brain areas. This is mainly used for individuals that have refractory seizures, difficult to treat seizures, or they don't respond to medication. Sometimes individuals can be deemed medically refractory. There's also what's called vagus nerve stimulation. This prevents or lessens seizures by sending regular mild pulses of electrical energy to the brain via the vagus nerve. This is also a common treatment for refractory seizures. So the VNS is a stimulation device that's implanted under the skin in the chest. So most of the time individuals are not aware of the stimulation when it's working. But individuals that are aware of their seizures can swipe a magnet over the device that's in their chest, and it sends out a burst of stimulation to the brain. And then there's also what's called neuromodulation. So this is a small device that's used to send electrical currents to the nervous system. The electrical signal is intended to change what the nerves in the brain do. The purpose is to make the brain cells perform their functions correctly. This is primarily used when medication doesn't control seizures or surgery isn't an option. How are seizure disorders treated in schools? Well, children are eligible under IDEA Part C for early intervention services. This includes a comprehensive evaluation. Children are typically classified as other health impaired. They're eligible for services such as physical therapy, behavior therapy, skills development, and self-help in social emotional areas, and family support, training, and counseling. And there's also IDEA Part B services, which includes an IEP. So once they become school-aged, they can receive physical therapy, behavior health counseling, occupational therapy, an intervention plan for academic or behavior concerns. And these children can also thrive in different classroom placements, depending on the nature or severity of their seizure disorder and their academic performance. So they can thrive in inclusion, resource classrooms, and self-contained classrooms. They're also eligible for Section 504, which are accommodations and modifications. They have a medical diagnosis or a deficit in a major life activity. Time for a quiz. How many seizure disorders are there? A, 15, B, 16, C, 40, or D, 35? The answer is C, 40. Which of the following is considered most common? A, epilepsy, B, neonatal seizures, C, seizure disorders, or D, refractory seizures? A, epilepsy. Which symptom presentation is associated with unknown onset seizures? A, tonic, B, myoclonic, C, tonic-clonic, or D, clonic? C, tonic-clonic. Which is recommended as the preferred treatment for seizure disorders? A, AEDs, B, VNS, C, surgery, or D, neuromodulation? A, AEDs. Let's look at a case profile. Zara is a 5-year-old female student in kindergarten. She was diagnosed with epilepsy earlier this year after experiencing recurrent tonic-clonic seizures. She has a deficit in working memory and struggles at school. She currently takes anti-seizure medication but is still prone to seizures. She lives with her mother and father and 4 siblings, 2 sisters, ages 1 and 7, and 2 brothers, ages 6 and 8. The referral concern is academic and social skills. For cognitive functioning, Zara has an average IQ, low average working memory, and difficulties with coordination. For Zara's academic achievement, she has trouble sustaining attention, difficulty naming and remembering letters of the alphabet, and she has an average work completion of 40%. For social, emotional, and behavior functioning, Zara is anxious, irritable, and often socially isolated from peers. For adaptive functioning, she has low average conceptual and social skills, although she's developmentally appropriate with her daily living skills. Zara Kate's treatment plan. Zara's treatment goal is to increase her letter naming fluency. The treatment objective is to provide a drill and practice intervention for rapid letter naming skills that results in improving Zara's letter naming fluency to grade level. Given a kindergarten Dibbles letter naming fluency probe 3 times per week, Zara will correctly identify 62 letters during a 1-minute probe by the end of kindergarten. Results of direct assessment indicated that Zara's reading skills are at an early kindergarten level and that she lacks basic fluency skills. To obtain baseline measurement, a kindergarten level probe of letters to name was given. Zara was only able to identify correctly 11 letters during a 1-minute probe. To monitor progress, the teacher will use Dibbles probes each session. The probes will be scored, and the median score will be used to determine Zara's progress. This progress will be monitored weekly, in addition to check-ins for treatment integrity. Another treatment goal for Zara is to increase her social skills. The treatment objective is to provide a socially based intervention delivered in a natural setting for social interaction and communication that results in increasing Zara's social skills by targeting basic social responses such as eye contact, name response, and greetings, and complex skills such as initiating and maintaining conversations through individualized instruction and guided practice 3 times per week. Zara will have increased her social skills by learning steps to appropriate interaction with peers and adults. To obtain a measurement of baseline data, observations were conducted in the classroom. Zara is socially isolated from her peers. She often works alone and plays alone. Progress will be monitored weekly in addition to check-ins for treatment integrity. The teacher will record data for each session with Zara using a tally mark system. The teacher will mark one of the following to indicate Zara's progress: correct, incorrect, or no response. Resource A is the Epilepsy Foundation. Their website has a variety of different resources, especially for professionals. Resource B is the American Epilepsy Society. They have resource, treatment information, and real stories about children with epilepsy and other seizure disorders. Resource C is educational support for teachers and school personnel. I found this resource especially helpful for both my first presentation about Fragile X and this presentation for seizure disorders. It actually has a variety of different disabilities and disorders, including the 13 categories of IDA listed, and it has different skills and deficits that children may face. And you click on it, and then it gives different tools and tips to try to help that child with that area. So I found that very helpful. Resource D is a fact sheet. This has gotten to be the best fact sheet that I have found for a disability or disorder by far. This has information about what is epilepsy and seizure disorders, symptoms, categories, and if you look on the right, it also has a seizure observation record. So if you remember the 3 important things for differentiating the symptoms, which are the onset, an individual's awareness, and movement, it takes that and it puts it into this observation record. But it does it on a whole new level. So I'm not sure if you can see, and I apologize, I try to make it as big as possible. But it has pre-seizure observations, list and describe behavior and triggers, awake when the seizure just started, and then it says sensations experienced by the person. I mean, I just thought this was a really great tool and resource for a person experiencing seizures or prone to seizures. So again, I just thought this was a really awesome resource. Thanks guys for listening. I hope that you have learned a lot about seizure disorders.